two car dealerships had the same exact car for sale, but one cost 60% more than the other, which would you buy? The less expensive one, I hope. We all look for ways to save money on a daily basis, whether it's ad matching at Walmart, going to the cheapest gas station, or shopping online for the best deal. So why should our healthcare needs be any different? With over 8 years of experience in both hospital and ambulatory surgery center settings, I hope to share with you some cost-saving opportunities you may not be aware of. The purpose of my speech today is to persuade you to utilize ambulatory surgery centers for your outpatient healthcare needs as opposed to the hospital outpatient department. To do so, I will explain that the ASC can save you money, reduce your amount of downtime, and is a safe alternative to the hospital outpatient department. The ambulatory surgery center is a low-cost alternative to the hospital outpatient department. According to the ASC Association, the outpatient surgeries performed at the ASC are reimbursed at 58% of what they are reimbursed at the hospital. Commercial insurance payers also pay significantly less at the ASC. While this disparity in reimbursement is not necessarily favorable to the ASC, there's no reason that you, as a consumer, shouldn't take advantage of it. For example, let's say you have 20% coinsurance on a procedure that costs $2,000 at the hospital. That's $400 out of your pocket. Personally, I'd rather pay $252 or 58% of that at the ASC for the same exact service. In addition to saving you money, the ASC can save you time. In the Center for Disease Control's 2006 National Health Statistic Report, the average time for surgical visits to the hospital-based ambulatory surgery center was 48.9 minutes longer than a freestanding ASC. The goal for patient length of stay at the ASC I work at is 3 hours for most procedures. Considering that the hospital outpatient department requires you to show up 2 hours early for your paperwork and pre-admission testing, it's highly unlikely that you're going to be in and out of there within 3 hours. You might think that ASCs sacrifice safety for their efficiency, but that's far from true. Many states are required to report healthcare-associated infections, such as New Hampshire. According to the New Hampshire Department of Health and Human Services, the incidence of infections in hospitals statewide was 183 for 2013. Compare that to only 6 infections in ASCs for the same period of time. Additionally, ASCs reported higher adherence to infection prevention methods such as prophylactic IV administration, which is reported to Medicare on every Medicare claim. The purpose of my speech was to persuade you to utilize ambulatory surgery centers for your outpatient healthcare needs. As I illustrated, the ASC is a convenient, high-quality, low-cost alternative to the outpatient hospital department. When I transferred to the ASC about 6 years ago, I was very skeptical that a small facility with only a few dozen employees could provide the same level of care that the hospital did. Not only can they do it as good, but they can do it better because that is all they do. Hopefully the need for surgical procedures is few and far between, but if the situation does arise, why not make the best of it by utilizing the smart alternative to the hospital outpatient department? The benefits of ASCs are gaining national recognition, as evidenced by the Ambulatory Surgery Center Quality and Access Act of 2013, which seeks to lessen the disparity in reimbursement between hospitals and ASCs while still saving Medicare and therefore taxpayers $2.6 billion a year. Thank you.
Good job.